Dr. Carl Hart is an American neuroscientist. He's a professor of neuroscience and psychology at Columbia University and is known for his research in drug abuse and drug addiction. He's just released a brilliant book called Drug Use for Grown-Ups. Now, Dr. Hart, it is a pleasure for me. I've actually been following your work for quite some time, and after multiple futile attempts to get in touch with you through normal email contact forms, surprise, surprise, as I always learn, Twitter saved the day. So I'm glad that I managed to catch your attention and we're able to do this. Now, the title of today's podcast is The Science of What Drugs Do to Your Brain. To the unexpected listener who's not familiar with your work, they might be expecting us to discuss the downsides of the terrible drug use, whereas in fact, we're going to look into the objective and scientific and surprising upsides as well of drug use and what is sadly, in both our views, considered actually a counterculture approach. So before we get into that, can you set the scene with a short introduction to yourself, please?
I'm Carl Hart. I'm a professor at Columbia University, and my research focuses on studying the effects of drugs like cocaine, marijuana, methamphetamine in humans. And we want to know things like, what do drugs do to the brain, behavior, social interactions, food intake, sleep, a wide variety of sort of effects we're interested in. And so I hope we have a good conversation.
Absolutely. And I think, one of the things I wanted to start off with really is, when people hear about what drugs do, often they focus on psychedelics and consciousness expanding drugs. But for the purpose of this chat, I want us to focus, more on your core work. So we're going to focus on some of the more surprising ones like cocaine and heroin, which you yourself have opened up to being a regular user of. So let's start there. Let's set the context of, you are what you preach and what you teach.
Well, when we think about psychedelics, psilocybin, a wide range of drugs, all of these drugs are essentially the same. When we separate them in these categories, it's basically done for the benefit of the person who's separating these drugs. But they're just chemicals and they interact with receptors in our brains. And those receptors are there because we have natural chemicals like the ones that we use, like the drugs we use. And so when people start separating them, you should be suspicious that something political, social is going on and not biological. And so I think that's the first thing. And so when I talk about having used cocaine, heroin, these sort of things, I've also used the other drugs that have been classified as psychedelics. But I just don't talk about that as much because psychedelics already have proponents, and these proponents have done a good job of rehabilitating the reputation of psychedelics while leaving in the dust the reputation of these other drugs. And so the psychedelics don't really need me. In fact, we need the psychedelic people to start paying attention to these other drugs.
Okay, so let's start with what these drugs do, both from your experience and scientifically to our brain. So, cocaine, heroin, methamphetamine, these are the ones that you specialize on speaking about. So give us a little bit of education to open minds who are interested in science, not politics.
Just briefly, if we take a drug, something like methamphetamine, what an area in the brain that we've studied quite a bit and learned quite a bit is what methamphetamine or amphetamines do to the monoamine neurotransmitters are things like serotonin, dopamine, norepinephrine. If you look at the chemical structure of the amphetamines and you look at the chemical structures of the monoamines, they look similarly. And one of the things that amphetamines does is that the amphetamines are taken up into a cell like it's a monoamine neurotransmitter. And then it kind of disrupts the storage of these neurotransmitters such that it causes a release of these neurotransmitters into the synapse. And so when neurotransmitters like dopamine, serotonin, norepinephrine are released, a variety of things can occur. When we have the stress response, these neurotransmitters are released to activate the stress response. They also are released when people are experiencing pleasure. They're released in movement, a wide range of behaviors these neurotransmitters participate in. It's more complicated because you say, like, you're stressed and these neurotransmitters are released, and you might feel anxious. But when you're feeling happy and pleasurable, these neurotransmitters are released. So we still don't understand the precise combination that's required for pleasure, the precise combination that's required for feelings of anxiety or stress. But just to provide a clue, people can know that they have their effects because they look in part like the natural neurotransmitters. If we move to something like cocaine on that same sort of system, cocaine, what it does is that it prevents the neurotransmitters from being taken back up into the cell and being reused. So what that means is that that neurotransmitter activates the receptor a lot longer because it's not taken back up into the cell. So once the neurotransmitter is released, cocaine blocks the reuptake of that neurotransmitter back into the cells. And then if we think about something like the opioids, heroin, those drugs interact primarily with the endogenous opioid system. The endogenous opioid system has a wide range of effects in the brain. One is to reduce pain. Stimulation of these endogenous opioid receptors reduce pain. But that's where we focus a lot of our attention on the monoamine neurotransmitter system. But when we kind of started our focus on this neurotransmitter system, there were only about 6 identified neurotransmitters. Today, there are over 100 neurotransmitters. And so, but our knowledge or our sort of belief or our theories haven't appreciably been updated to accommodate all of these newly identified neurotransmitters.
Got it. And so, for that was like a very good scientific response that gives like great clarity on the different drugs and then the different reactions. But like broadly speaking, in more human terms, like what are the positive effects of such, we call them illegal drugs, and what are the scientifically proven negative effects of such drugs? And is it possible to understand on a broader sense, if the positive outweighs the negative?
Yeah, you don't need a scientist to tell you the positive effects of these drugs. I mean, if people think about alcohol, what are the positive effects of alcohol? Well, alcohol can facilitate social interactions. It can function as an anxiolytic or anti-anxiety drug. It can, those are all can be beneficial effects. And then if we think of some of the negative effects, if people overdo it, particularly in extreme cases, if people are dependent on alcohol after years of use and then they abruptly discontinue their alcohol use, they might die. And so from alcohol withdrawal. So we kind of know what are the negative effects of alcohol and positive effects of alcohol. And so the question is, do the positive outweigh the negatives? Well, our society has decided yes, they do. And because the negative effects can be minimized with some basic education, basic common sense. The same is true with heroin. The same is true with cocaine. But those drugs have been historically vilified, not for pharmacological reasons, not for scientific reasons, but because of social and political reasons. So when we think about what are the beneficial effects of cocaine, let's say, well, cocaine can give the user energy when your body feels like it should be asleep normally, but the person has to be up, has some function, whatever. Cocaine can make the person feel energetic and then perform that duty. That's a good thing. Cocaine can also make the person feel euphoric. If you feel better, you're more likely to treat people better. Good thing. The negative thing about cocaine, sometimes if people get into heavy cocaine use, it can disrupt your sleep. And constant disruption of your sleep can lead to all kinds of psychological problems, physical problems. Sleep is one of the most important sort of human functions, and if you don't sleep, you can get in trouble. So that's a negative effect. But when you objectively weigh the negative and the positives far outweigh the negative. But what the society looks at is as a negative effects of cocaine, it's usually related to cocaine's illegality and not cocaine's pharmacology. So when we see cocaine, we say, oh, somebody had a horrible negative effect with cocaine. They had a cardiac event or a heart attack or something. And then what you find out is that cocaine is cut with some, I don't know, some adulterant that's not good for you. And it's not pure cocaine. And that's the problem. Many of the negative effects that we attribute to the opioids are really related to the restriction or the illegality of these drugs and not the pharmacology of the drugs. I hope that helps.
It certainly does. And actually, it's a perfect chance to say, if you could summarize into your top three takeaways for listeners looking to understand science of what drugs do and if the impact is positive over negative.
I guess the three top takeaways, if we think about it from a scientific perspective, think about it rationally and objectively and not emotionally. Just think about the effects of cocaine. Increased energy, increased euphoria, and then we think about potential cardiovascular effects, and you think about disruption of sleep, disruption of food intake, those sorts of things. But the important thing is that you have pure drug and not drug that's adulterated, because that's not cocaine, that's something else. So I'm talking about pure drug here. When you look at it from that perspective, it's clear that you should be allowed to make that decision. And this should be available to you because there will be people who get in trouble and they see those negative effects primarily. But that's the case with any activity. Driving an automobile. In the United States, we lose 40,000 people every year because of automobile accidents. But we don't ban automobiles. Instead, we try to enhance the safety of that activity. You are free to make these decisions. That's more important. That's the most important thing, that you are not living in a society that is filled with hypocrisy.
And I think that's exactly the right moment to end this conversation, because in the next one, we're going to talk about that limitation on our autonomy and the impacts of that. So Dr. Carl Hart, thank you so much for coming to join us on the Braincare podcast, and I look forward to chatting again next time.
Thank you.